So I just got back from my state conference and I had some great conversations with people, and this topic came up is, what does insurance what does health insurance and insurance companies think of physiotherapy? Well, if you just look at the past trend, we can start with Medicare. Medicare is constantly adjusting the cap, making it lower. They're constantly decreasing reimbursement, and they're constantly paying us less and less and looking for ways to not pay us. We're a non-vital service. So obviously the insurance companies are looking at us as not really expendable, but lower on the totem pole, and they're going to keep on, whether you realize it or not, insurance is going to reimburse less and less and less. It's not going to stop. If someone's in a life-threatening illness, they're going to pay for that, and PT is going to end up taking the hit, and they're going to start paying less and less, reimbursing us less and less, and seeing us as less value. And then, most insurance companies follow suit of what Medicare does. So what's going to happen to other health insurance companies? They're going to constantly decline reimbursement. They're going to set up more ways for us to jump through hoops, and they're going to, look at physiotherapy as less and less of a value, and even some of the Medicare laws, they say if a personal trainer and a massage therapist can do it, it's not considered skilled. So think about, what interventions are you doing, and can someone else do them? If so, they're going to keep on. Pretty soon they may not pay for exercise, even though exercise is a critical component to get your patient's outcome, especially a long-term outcome. They're going to not. If you're just exercising patients, they're not going to pay for that anymore. So, insurances are going to start reimbursing us less and less. It's unfortunate because we do provide great value still, but insurances are just going to pay us less and less. And then if you even look at the ACO model, okay, where's PT gonna fall in the ACO model? Regardless of all the research that we show of our cost effectiveness and the outcomes that we can get, the ACO is going to be ruled by the physician group, the health insurance company, or the actual hospital. And we're going to be on the bottom of the totem pole. The biggest ACO around my area just got hit with Medicare fraud and violation of Stark laws. I'm not naming names, but where was physiotherapy on that? They didn't unleash details, but it was all physician related. They were buying up local practices and physicians and forcing them to refer in-house. And they were violating Medicare rules and guidelines, and they got caught with Medicare fraud again for the second time. So PTs aren't going to thrive in the ACO healthcare model. The ACO is either going to be owned by the insurance company. They're already paying us less. The ACO is either going to be owned by the insurance company, the physician, or the actual hospital. So we'll just be a pawn on the chessboard again then. So my question is, with the changes that are going on in healthcare, especially with insurance companies, and the future of health insurance is going towards more high deductible healthcare plans. You're going to have patients having $4,000 deductibles, or even higher than that. You're going to have patients having an HSA account, and this is where we will capitalize, because I know that we have value and we can help people and show them great outcomes. But with the future of health insurance, it's going to allow a cash-based clinic to thrive. Because if this patient has a $4,000 deductible and you line up 4 different clinics where you can get treatment, you can go to standard care where you'll get double booked and triple booked. I even just talked to a student. He said he was in a clinical where they did an eval and treated a patient at the same time. I can't even fathom that, but anyway, you have the option of going to standard care and you'll pay cash because of that high deductible for garbage service and being double and triple booked. No one wants to pay that. Or you have option 2. You can go to the hospital and they're going to overcharge you 5 times the amount of the actual cost. So you're not going to pay for that. You'll meet your deductible, or why not pay cash at an outpatient private practice where you'll see the best, And if your deductible's $4,000, maybe it takes $1,500 or $2,000 to get your treatment done but still you'll get that great outcome. You'll save money because it's cheaper than the other options. You'll see the board certified specialist, and you'll see the same patient every day. I mean, the same clinician every day, and get the great quality of care you need. So with the future of healthcare and where insurances are going, yeah, they're going to devalue physical therapy and they're not going to pay us as much. But I think with going towards high deductible healthcare plans, this is where we'll thrive as a cash-based clinic. You know, you're going to be able to market yourself and then educate patients, or, you know, tell them to ask the right questions. Is this the cheapest option for me? Is this the best option for me? Hey, this guy over here says he can get me better in 10 visits for a fourth of your cost, but then you're saying you want me 3 times a week for 4 weeks, but you're going to charge me $3,000 because my deductible is three grand, or my deductible is like $4,000 anyway. It's a high deductible. So that higher deductible healthcare plans is going to create value, or patients to at least be aware of value and cost effectiveness. And this is where the cash-based clinic is going to thrive. So just some ideas for you. I just got inspired because I came back from my state conference, had some great conversations with people. Just figured I'd blog and write up something about it real quick. But let me know what you think. Let me know if you agree with some of my statements, or if you have any questions or concerns. I'm here to help.